Let's try the softball hand treatment. Let's begin with the wrist assess. I want you to place your elbows and your palms together and take a nice focused breath. I want you to notice what your upper back feels like before you begin. Then slowly move your wrists. I want you to notice if it feels like your wrists have any stiffness or if it just hurts to move your wrists to end range. Then drop your hands back as far as you can. When connective tissue is hydrated, your hands will drop back and make a letter T. If you look at your hands and you're seeing a V, a W, or your fingers have coiled back, I always say it's kind of like wearing a size 4 pair of jeans when you should be wearing a size 8. You're literally losing some of the extensibility in the tissue and you've lost some of the range of the joints. Now bring your arms down and notice if your shoulders also feel a little stiff just from holding your own arms up for a few seconds. If you're feeling that stiffness, that's also what it feels like when we have a little bit of accumulated stress and dehydration in the tissue. Let's also try our grip assess. Squeeze the ball a few times in one hand and assess your grip. And then go to the other hand. Notice if the grip feels balanced from left to right or if one hand feels like it has a weaker grip. The hand that tends to have weakness is usually a side where we've got more accumulated stress and connective tissue dehydration, causing a little bit of an impairment in the nervous system to send good strength back to your hands. Let's also try finger compression. This technique is not only a great way to assess if your fingers are functioning efficiently, but it's also a great way to restore movement in the joints of your hands. I want you to see if you can hold the ball in between your middle finger and your thumb. Place the tip of your finger on the ball and begin to press the tip of your finger onto the ball and then the pad of your finger. I want you to do this 4 or 5 times. What we're looking for is if you can actually mobilize this first joint. Now let's try it on the middle finger. Same thing, pressing the tip of the finger and then the pad of the finger on the ball. If you're having trouble holding the ball in one hand, watch this. Hold the ball. Don't make it a magic act. Just keep the ball in one place as you create that movement. Now go to your ring finger and try it here. As soon as you get to the ring finger, you might notice that that joint does not move as well as the other two. So if you're already having trouble, don't not do it. Just place 2 fingers on the ball and see if then you can create that mobilization. Now try it on your pinky finger. Same thing, extending and flexing the joint. See if that joint moves just as well as the other ones. Then try it on your thumb. Cradle the ball in between your fingers, press the tip of your finger into the ball, and then the pad of your finger. I always say this one should be easy because we're texting and using our thumbs so much in a day. This joint should be able to move pretty well. Let's try it on the other hand. Same thing, tip of the finger and pad of the finger. If you have long nails, just angle your fingers so that you can still mobilize that top joint. Try it on the middle finger. So again, if you're looking at your fingers and you're saying, gee, my finger is not moving, remember, you could put 2 fingers on the ball or even 3 fingers on the ball to see if you can recreate the action of this joint. Let's try it on the pinky finger. Flexing and extending. So remember, if you need to, hold the ball in one position if you have trouble holding the ball in your hand. I also want you to try it on your thumb. Same thing, pressing the tip of the thumb and then the pad of the thumb. Make sure that these joints always have movement. Most of us don't realize we've lost movement in the upper joint, but that's the first joint that starts to become inflamed. And what you do notice is that the other knuckles start to swell. Now let's try position point pressing. Place the ball on the table and place your left hand over the ball at position point number 1. That's the center of the palm. Your right hand is going to be the treatment hand so that the left hand can stay completely relaxed. So try not to use too much force with the hand that you're treating. Let the arm stay relaxed. Using your right hand, I want you to create gentle pressure on the center of your palm and take a focused breath in and out. Then decompress and find position point number 2. That's the knuckle that coincides with your first finger. Create gentle compression and then decompress. See if you can identify the joint that coincides with your second finger and create gentle pressure. Take a focused breath in and out. Then go to your ring finger. Same thing. Create gentle pressure down and then release. And then the fourth knuckle. Create gentle pressure down and release. Let's see if we can find position point number 3 at the thumb pad. Create gentle pressure and decompress. Position point number 4 at the base of the hand and out. And see if you can identify position point number 5 on the pinky pad and give that one a little compression in, and then decompress out. Easy enough? So let's try it again. Same hand, create gentle pressure on position point number 1. Create gentle pressure, and then decompress. Let's go through position point number 2s. So remember, for as long as it takes you to take a breath in and a breath out is as long as you create pressure on any point. And remember, the hand that you're actually treating, you want to keep as relaxed as possible. Let your other hand do the work. Try that pinky knuckle. Create gentle pressure in and out. Now let's try 3, 4, and 5. Create that gentle pressure on the thumb pad, decompress, then the base of your hand, and decompress, and then position point number 5 on the pinky pad. Let's try it on the other side. So this is pretty simple. We just create gentle pressure, position point number 1, and then decompress. And now let's go across all of the 2s, starting with the index finger, creating gentle pressure, and then release. And then go to your middle finger. Same thing, create gentle compression, and release. And then the ring finger. Take a nice gentle breath in and out on each point. And then decompress. Try that pinky knuckle. Create gentle pressure. And then decompress. Now let's try position point number 3. Create gentle pressure on the thumb pad. Take a nice focused breath in and out. And then at the base of the hand, position point number 4, and then decompress, and then position point number 5, create gentle pressure. Let's go through it one more time on this hand. So remember, position point pressing mobilizes the joints. For as long as it takes you to take a breath in and a breath out is as long as you create compression on any point. So it's only one gentle pressure on each point. And remember, you're not doing CPR to the ball. You don't have to press it as hard as you can. You might not feel like anything is happening, but what we're doing is gently stimulating the sensory nerve endings that live in these joints, and we're creating body-wide signaling throughout our entire body so that we create some natural balance with just the hand treatment. So now I'm on position point number 4, decompress, and now let's go to position point number 5. Keep the pressure on that point, place your middle finger on the table, and let's try gliding back and forth between the 3, the 4, and the 5. Now in this move, you can keep your other hand resting atop the hand so that we actually keep that gentle pressure and we keep the other hand relaxed. If you're comfortable by just keeping gentle pressure and you don't press too hard, you can do it with the hand all by itself. Let's try the glide on the other side. So remember, gliding is a small local compression technique. You want to keep the movement small and consistent. It's not about the depth of pressure that makes the glide work, it's the consistency of pressure that really creates the preparation for the shear. So now let's try shearing on your left hand. Place the ball at the base of your thumb pad, and I want you to create that shearing motion. This is called a direct shear. This is just this nice scrubbing motion, keeping the pressure constant, just moving it any which way, and you can even close the thumb to the hand so that you can get it on the edge of the thumb. You could also try an indirect shear here by just sustaining your pressure, just wiggling your thumb around. So if it's hard for you to navigate the shear doing it directly, try the indirect shear. But remember, once you create a shear force, just wait for a moment. Give the tissue just a second to adapt so that we create the fill effect. Take a focused breath, and then let it go. Let's try it on the other side. So shearing is a way to stimulate the cells of your connective tissue. One thing we know about connective tissue cells is they're very reactive to small local areas of stimulation. So if you keep the movement small and controlled, you'll make the biggest benefit. What this is doing is creating a local fluid exchange just in the hand. Remember, you can also try an indirect shear by sustaining pressure and just moving your thumb. Again, once you do any type of shear technique, just wait there for a moment. Give the tissue a moment to adapt. Take a nice focused breath. And now let's do 2 types of rinsing. Let's start with the forearm rinse. Start with the fingertips on the ball and move the ball all the way to the top of the elbow. Then release and go back to your fingertips and rinse. Now you can go under each finger all the way up to the elbow and just keep the pressure constant. Just like gliding, it's not the depth of pressure that's creating the fluid exchange, it's the consistency and direction that's creating the most benefit. So rinsing is the global technique. This is drawing fluids clear up to your neck and back, so as you're doing this, you're actually creating a fluid exchange all the way up into your upper body. Let's try 2 more rinsing passes. And then let's go to the other side, same thing. So remember, rinsing is the global technique. This is how you bring fluid throughout your entire body. And the secret here is consistent pressure in one direction. It is kind of like putting your hand in a tub and starting to spin it around. The fluid just starts to follow one direction. Let's go 2 more times on this forearm. And now let's try finger rinsing. Place one hand down on the table and begin to rinse the fingers from the base of the finger to the tip of the finger. I don't care which finger you start with, as long as you go over them all. And you can go on the side of the finger and the top of the finger and then the side of the finger and the side of the finger. As long as you go in just one direction, it's easy. And remember, rinsing is consistent pressure. It's not about depth. But don't forget your thumb. Go right over the edge of the thumb. The thumb is loaded with stuck stress. Let's try it on the other hand, same thing. Place the hand down and begin to rinse. Now notice when I go over my fingers, I'm not going over the back of the hand. I'm just going over the fingers of the hand that's on the table. But on my top hand, watch how I keep going over my wrist repeatedly. So I'm getting the most out of the movement by creating the fluid exchange down my fingers and right back up the forearm, so that we create that circular motion of the fluid just like it moves in the hands naturally. Let's try one last technique called friction. You can do this one in between your hands by lightly rubbing the ball in between each finger, and you can focus on one hand or the other. You can also do this on the table. Friction, you'll remember, is just a light vibrational motion. Don't put any pressure on the ball as you do friction. This just stimulates the lymphatic system. It brings some fluid and blood flow to your skin, which is just a great thing to do to keep your fingers pain-free. Take a nice focused breath. The really interesting thing is if you bring your hands open, you might feel this buzzy, tingly sensation moving up the forearms. And if you feel that, that's actually the fluid exchanging all along those sensory nerve endings. So now let's see what that fluid is doing to your ability to move your wrist or create a better grip. Let's place our elbows and palms together. Take a nice focused breath. Notice if holding your arms up is easier for you, if your back feels more open. Then begin to move your wrists. Notice if your wrists are more freely moving or if you have a little bit less stiffness than when you started. And then drop your hands back. If your hands look more like a letter T just from doing the softball treatment, we are well on our way to restoring hydration to your neck. Bring your arms down and notice if your shoulders don't feel so stiff the second time around. That's also showing the fluid exchange has already occurred up at your neck. Now let's also try our grip assess. I want you to reassess by just squeezing the ball 3 or 4 times in one hand, and then try the grip reassess in the other hand. Notice if your grip is stronger or more balanced from left to right. This is a neurological change. If you feel like your grip has improved, we've not only restored hydration in your connective tissue, we've helped your autopilot go back into balance. Take a nice focused breath and really get a sense of what it feels like when your hands are more open and receptive.